My name is Jonathan Lee. I will be helping you understand the intricate details behind a doctor's visit.
Hello, my name is Tanner Morris, and I am currently interning under an obstetrics and gynecology office in Riverside, California. I will be including examples of how patients approach scenarios when coming in for a visit.
Visiting a doctor's office is important to both you and the doctors themselves. Despite insurance being a touchy subject, you need to be aware that certain doctors are only capable of seeing patients with certain insurances. HMO and PPO insurances may even dictate whether or not you need a referral for a visitation. Make sure that your doctor is able to receive payment from your insurance provider.
For example, the doctor I work under is unable to accept patients who are insured by Medi-Cal. If a patient has Medi-Cal, we must refer her to a doctor who does. Also, the doctor I work under requires no referral from patients with a PPO insurance provider, meaning that the patient can schedule appointments whenever she may like, with no need of approval from her primary doctor. Make sure to communicate with your doctor what insurances work and which ones don't, so that no payment issues arise in the future.
Some payments may still be required when scheduling a doctor's visit. This is known as a copay. Copays are listed with prices on the patient's physical insurance card. Make sure to communicate with your doctor about available payment methods.
The OBGYN I work under only accepts cash and Zelle forms of payment. Not knowing this information has resulted in patients making long drives to the office, only to be turned down service due to unfortunate inability of the patient to fulfill the copay in the appropriate manner. Be sure to contact your gynecology office and clarify how payments are expected to be covered. Keep in mind that some insurances do cover the copay if there is no dollar amount on your insurance card.
In regards to a gynecology office, optional company may be of use to a visitor. A female visitor is not limited to just a male doctor, as they might feel uncomfortable with having a male doctor check up their female parts. To alleviate this potential issue, the patient is able to request a female doctor or a female nurse. This is to ensure the utmost comfort of a patient when they want to get their female parts checked.
Looking into the visitation rooms, they are nice and roomy, welcome to hold multiple people per checkup. Doctor allows her patients to bring whoever they want into the rooms during a checkup. If patients do request another medical professional in the room, that is also an option she provides. Doctors should be flexible and understanding, because remember, your comfort is our number one priority.
A pap test is one of the most important parts of a gynecology exam. It's used to look at the cells of the cervix, the narrow lower part of your uterus that connects to your vagina, in order to find cells that could turn into potential cervical cancers. It is the best way to prevent cervical cancer. During a pap test, a nurse or doctor will put a plastic or metal tool called a speculum into the vagina. The speculum opens up to separate the walls of your vagina so that they can see the cervix. Feelings of moderate pressure or mild discomfort may occur when the speculum is inserted in. Usually, a small spatula or a tiny brush is used to gently collect cells from the cervix for the pap test. There would be light scarring, or you may not feel anything at all. There may be some staining or bleeding afterwards. Many female patients want to talk to their gynecologist about their medical histories, menstrual cycles, potential sexual history, and pregnancy or fertility. Medical histories can include talking about sexual history with your gynecologist. Your gynecologist can determine why you may have pain during intercourse or help answer your questions concerning other sexual problems. A change in menstrual cycles can help with your gynecologist determine whether these changes are normal or abnormal and provide required treatment. Finally, informing your gynecologist if you are pregnant or trying to conceive can provide valuable advice on pregnancy tests, early signs of infertility, pregnancy in general, and ovulation kits. They can also offer genetic carrier screenings before the pregnancy.
The doctor I work under fulfills all the listed concerns a patient may have. Having communication with your doctor, including before, during, and after a visit, ensures the best experience and ensures effective treatment, especially within the field of gynecology and obstetrics.